Hometown station KHTS, this beautiful Wednesday, almost afternoon, well, 12:05, it's the afternoon now, but beautiful to be here. We were just talking off air about the Super Bowl and being back in Minneapolis. Carl Goldman here, having come back from the Super Bowl and experiencing that Minneapolis weather, and the most exciting thing about leaving Minneapolis is knowing I was coming back to Southern California weather, where we're back in t-shirts and not single-digit weather. This is the City of Hope Hour. What's really cool about it is you're driving around town right now. If you want to learn about the City of Hope and their impact here on Santa Clarita and what it means for all of us here in our own community, you're going to want to stick around and find out about that. Amanda Egolceder. I'm doing it slowly, but by the end of the show, it'll be Egolceder is with us, and she joins us on a monthly basis here to talk about all the fine things the City of Hope's doing here in the community, and then also with us each time we get to have a different doctor, and with us will be Dr. Seth Cohen, and we're going to learn about his journey in a minute or two. But Amanda, I'd like you to start. Just for those who are tuning in for the first time, and we're now on FM 98.1, so this is the first time you've got us on the FM as well as AM 1220, and of course streaming live on the web at hometownstation.com. If you haven't downloaded your phone app yet on your iPhone or your Droid, just plug in KHTS AM, but you're going to get that digital signal on your iPhone and Droid. City of Hope really has a strong presence here now in Santa Clarita. And maybe you can, for those just tuning in for the first time, share with us the overview. First of all, the overview of the City Hope to begin with.
Yeah, absolutely.
Not just in Santa Clarita. And then let's drill it right down to what you're doing, the great things you're doing here in our valley.
Yeah, well, City of Hope is a huge comprehensive cancer care. We have our campus in Duarte where we offer clinical trials, research, a wide variety of different treatments that we're offering. We're well known, especially for our research and what we're doing in advancements of cancer treatment. However, in the Santa Clarita Valley, we have what's called a community clinic, and we have 14 of those throughout LA. In Santa Clarita specifically, we're offering gynecologic oncology, medical oncology, and hematology, urologic oncology. We have UroGyn, which you'll hear from Dr. Cohen today. And we have access to clinical trials here. And the reason we have these community clinics is so that if someone is diagnosed in this community, they don't have to drive all the way to Duarte to get that amazing care. It's available in our community. Our doctors live here, work here. They're privileged at the local hospitals. So it's really a great thing that's available here in Santa Clarita Valley.
And when you say they're privileged at the local hospitals, it means they can do surgeries and care
see their
at
patients
Henry
and
Mayo, Providence, Holy Cross, and a number of our others within the region.
Yep, exactly.
Which makes it really helpful. City of Hope's been on the cutting edge of research also, and you touched on it for a second, Amanda, but I'd really like you to dive into that a little further, because I know when it comes to cancer research and all that's taking place with cancer research, there's so much going on, but you can really pinpoint that top tier of hospitals and research centers, and City of Hope is one of those, leading the way in so many areas.
Yeah, actually one of the biggest things that was just announced, I think it was couple months ago, was we are one of the first authorized by the FDA to do CAR T-cell therapy. I will actually let Dr. Cohen take over to speak more about the research. So, yeah.
Okay, and we'll come back to that. So let's introduce Dr. Cohen. If you move your microphone up a little closer.
Sure.
And
I see it bringing around here. Okay, there we go.
So share with us exactly what your specialty is.
Sure, my specialty's a little unique in the sense, I certainly see cancer survivorship patients, but I actually see a lot of patients that have not experienced cancer yet. And so I'm a urologist, and my focus is in female pelvic medicine and reconstructive surgery. And so really that's tantamount to urogynecology or female urology, however you'd like to call it. We deal with pelvic floor disorders. And so a lot of the patients we see will be suffering with urinary incontinence, perhaps fecal incontinence. They'll be suffering with pelvic organ prolapse, which essentially is a hernia of the pelvic floor. They may be suffering with recurrent urinary tract infections. And so it's a wide variety of different unfortunate things that can happen to the pelvic floor.
And it doesn't mean that they have cancer.
Exactly.
Correct?
That's certainly I see patients that are dealing with cancer or have survived cancer, and they're now really just trying to optimize the quality of their life. But I also see patients that are just dealing with the after effects of a benign, bothersome process, and we're happy to see those patients and help those patients as well.
So share with us a little bit about the change in the whole medical profession, what you've seen from your field. I see you're wearing a robotic surgery logo on there.
It's amazing to, I'm a little bit of a history buff also, in addition to, being a physician. And it's just amazing to see in the last 100 years the journey medicine has taken. Really within the last 10 years, we've made leaps and bounds in minimally invasive surgery with the introduction of robotic technology, if you will.
100 years ago, just to put it in perspective, they were still putting leeches on you to pull your blood out. Yeah,
exactly right. We didn't even have antibiotics until the 1940s. I mean, think about that. We really didn't have a profile or library of antimicrobial therapy until just before World War II. How crazy is that? And so really when you think about where we are now, we're in the era of genomics and CAR T-cell therapy and robotic surgery. I mean, these are all things, and I mean, we're fortunate to live in a location and country that has access to these advanced technologies, and amazingly, here locally as well, Santa Clarita. And so, robotic surgery is something that me and my colleagues are well versed in, and we enjoy it because it allows us to offer minimally invasive therapy to our patients, and we have really good outcomes. It's a tool like any other tool. The person using it has to know what they're doing, and you have to have a goal in mind. And for me, in my practice, I use robotic technology to do something called a sacrocolpopexy. That's kind of a long, fancy word to basically say we're repairing pelvic organ prolapse, which is that hernia of the pelvic floor we were talking about. You guys are fortunate to have some hospitals in the area that have this robotic technology, and certainly, we use it. And so, City of Hope is excited to be a part of the community here and provide these advanced therapies.
We're talking about the City of Hope here on your hometown station, KHTS, with Dr. Seth Cohen and Amanda Eagle-Cedar.
Nice.
Eagle-Cedar. I got it. I've watched Kyle Jelling. By the way, Kyle Jellings is not here. I'm Carl Goldman filling in for Kyle because his wife just had a set of twins, and he's home.
Congrats,
I think
Kyle.
he'd probably rather be here right now because he's got to watch all the other kids. But we'll check on that when we check in on him next week. But anyway, I'm filling in, and you both mentioned Carta cell therapy. Is that right? CAR T-cell therapy?
CAR T-cell therapy. Essentially, it's
what is it?
There's a new emerging discipline. It's been around for a number of years, but really is now taking off, called immunotherapy when it comes to managing cancer. And so CAR T-cell therapy goes back to the thought that you can use someone's own immune system to kill a cancer. And they're, it's really fascinating stuff, and you can write books about this, and PhDs have spent careers on this to some extent. But the bottom line is you're taking someone's T cells and you're using their T cells to attack their cancer. And it's had some really amazing outcomes, initial outcomes in really scary disorders like glioblastoma or brain cancer, diseases that we, up until now really had nothing was effective. And so you can see how on the horizon there's great things to come.
Is that the same treatment as changing or altering the DNA in a cell and using that to fight it?
That's part of the process. That's certainly part of the process. And so part of making these T cells active fighters against this cancer is trying to create a genetic code within them that puts them into a mode where they're attacking those cancer cells. And so, yeah.
And I ask that because the national news has now picked up on that in the last week or so.
Yeah. And it's exactly true what Mandy says is that really City of Hope is truly one of the first, recognized comprehensive, cancer centers that has been essentially been given approval by governing bodies to really start doing very active trials in this. And so it's exciting stuff and really amazing stuff that they have. A lot of the thought center for this is in Duarte's campus, and while this is all initiating there, I'm sure the hope is that down the road this will trickle out to the community clinical sites as well.
So as you've been talking about this, and I guess the news media now is dumbing it down for people like me, so we understand it, and they're latching on to the fact that they're altering the individual's DNA within a couple cells, re-injecting that in so that they can then fight the faulty cells with DNA. Is that's a simple? Did I dummy that
Carl,
down?
you did a good job. I think that's a pretty good summary of the process. And so, certainly a lot goes into that. But yeah, it's essentially removing. There's also these other keywords, checkpoint inhibitors. You're essentially removing the brake on the immune system. There is a brake that exists on the immune system to keep it in check so it doesn't attack your body. But what they're trying to do is find the right brake to remove. Take that break away, just get rid of it, and give it the opportunity to fight just the cancer cells. And that's what we want it to do. We want it to be able to really be the attack dog it can be, but not super harmful for you, just harmful enough for the cancer cells and to get rid of those cancer cells.
And this concept probably could fit other diseases as well. They're probably doing similar things to fight Alzheimer's or look at ways to combat Alzheimer's, dementia.
I'm constantly impressed and amazed by what you see when you delve into the research profile of our institution and the people that are engaged in those processes. There's a very, very significant effort at City of Hope to really cure diabetes. And there's an initiative to cure diabetes within the coming years. And I tell you what, it's not their own possibility. They really have some fantastic work they've done on that. With Dr. Riggs and some of the other really well-known profiled researchers at the institution. So,
we're talking with the City of Hope folks here, and we mentioned at the beginning of this program here on KHTS how City of Hope has a large footprint now in Santa Clarita. Amanda, you talked about how it makes it so much more convenient and accessible. Dr. Cohen, with your day-to-day routine,
Sure.
What are you doing here in Santa Clarita specifically? What's your day like here for the Santa Clarita patients?
Yeah, sure. So typically, I'll see patients over at our Santa Clarita office, which is a really beautiful location here in the area.
You're right on Valencia Boulevard, right?
Exactly.
Right near City Hall.
That's exactly right. That's exactly right. And so my patient population tends to be a majority women. Usually, and I see all ages, but usually most of the women are middle-aged to elderly.
And why is it more women than men?
Yeah, because that's my specialty focus. And so as a urologist, actually most urologists see mostly men because of the specialty and male reproductive health. My particular practice in the specialty I focus on really deals more in female pelvic health. And so it goes back to that pelvic organ prolapse, urinary incontinence, fistula, recurrent UTI practice. I see some patients with neurogenic bladder disorders, and those are bladders that are just not functioning because of neurological issues like Parkinson's and spinal cord injury. But certainly a large portion of the practice are women coming in with these pelvic floor disorders, which are extremely common. If you have a grandma or an aunt or a mother, there's a reasonable chance she's got a pelvic floor disorder. Now, it's all gradations. These are quality of life issues, thankfully. Usually this is leakage of urine when you don't want it to leak. This is, having to run to the bathroom all the time when you don't want to go. So these are really quality of life issues. But I tell you what, they can be somewhat debilitating, really bothersome quality of life issues. And so, why did these things happen? Well, it's aging, but what does that mean? It really means the trauma of pregnancy. So having pregnancies, even if you had C-sections, just holding a pregnancy for 8 to 9 months can contribute to the degradation of the pelvic floor. It's the change in hormone status as women are maturing, estrogen's going away, those tissues are becoming more delicate, more friable, weakened. All these things contribute. And so, my job, I feel like my job is to help improve the quality of their life and let them know that they're not alone, and to give them reassurance that we can do something to make it better.
So your advice is to not get pregnant and also not get old, right? And then we've solved it all right there.
All right, Carl, if you create that, we're running with it. If you get a time machine, we're out of here. That's it.
Got it. Done. Okay, we solved it all.
That's right.
Who needs any of the new DNA research there? Seriously, though, there are things all of us can do to prevent stuff. Some of it is the basic, just being smart about nutrition, exercising,
Sure.
not doing things totally out of proportion. But are there is there a certain list you have? If you could rewind the tape and say,
Sure.
Okay, Amanda, here we go. Here's 5 things for you to do
The rules you should follow.
That's right.
before you ever have to come visit me.
No doubt. You hit on some of them. Certainly, not being obese and having an appropriate BMI body mass index is important. And that goes back to living a healthy lifestyle, not eating poorly, working out 3 to 5 times a week, 30 minutes at a time, and really doing as much as you can to treat your body like a shrine. And listen, not over the top, and we all like ice cream. You got to enjoy life, but there are there are gradations, and you have to do everything in as much as possible in some sort of moderate amount. Things that can make you better: weight loss, working out, not having diabetes, not having high blood pressure. Also, in general, recognizing when things are going bad. I have women that have come to see me many years after their process has started, and they're like, oh, I just never knew help was available, or I never sought to seek help, or I was taking care of my kids, I was taking care of my grandkids, I was taking care of everyone but me. I guess I would say, listen, take care of yourself too. It's okay. You owe that to yourself. And I've had a number of women come in with something fairly scary that shouldn't have been scary 5 years earlier. And it's just because they were trying to take care of everybody around them and not themselves.
And not taking a minute or two to notice the signs, or maybe what I've seen quite often is they're scared, and so they don't want to notice the signs.
That's a very astute observation.
Right.
I think that's very accurate as well. It's a very anxiety-ridden proposition walking into a doctor's office and being told what's wrong with you. But hopefully you find the right doctor and you develop the right relationship, and it's all about a journey of self-improvement, and that's kind of what we're there to help with.
Dr. Cohen, you mentioned diabetes, not having blood pressure. Those are really preventative too in many instances,
right,
by being smart, again, not smoking, moderation on drinking, exercising, where you mentioned 3 days a week at minimum, 3 days a week,
for 30 minutes
at a time.
Right.
And being cognizant of your nutrition,
Sure,
not being overweight.
Sure, and we were even talking a little earlier about pelvic floor physical therapy, which is actually physical therapy specifically for the pelvic floor muscles. And you guys are fortunate up here to have the physical therapists at Henry Mayo Newhall, they're a fabulous pelvic floor physical therapy group. And we send patients from Lancaster over there all the time because they don't have that access. And there are specific exercises they can work with and teach you to help strengthen those muscles you normally don't even know you have. These are the muscles that help hold up the uterus, the ovaries, the bladder, things that we don't really talk about very much, but we should. And they're a huge part of who you are. And believe it or not, you can do exercises to strengthen those muscles. Once again, you have to do the exercises at home. It's not that phenomenon where you just do the physical therapy and you get better. You have to do the exercises when you get home too. But you should use that, access that through a provider and try to make yourself better.
So are there preventative exercises too before, we're teasing about not getting pregnant, but are there exercises women should do prior to thinking about getting pregnant?
There are Kegel exercises, which is a fairly common term. People know what that is, but essentially if you imagine yourself trying to stop your urinary stream midstream and hold it for 30 seconds, that's a Kegel exercise. And actually, it's kind of hard to do well. It's not that easy. If you do, 20 Kegels in an hour, you should be a little tired. It's a pretty aggressive hold, and so.
And how long do you hold it for?
I tell patients as long as they can. And the goal is not to just clench and release. You want to hold it for like 30 seconds to a minute to give yourself the benefit. It's like working out in the gym. You want to do a few reps and really try to hold safely, and release. And so,
And would that be true for someone who's aging right now?
Oh, yeah.
That may not have pumps. So you'd recommend. How about for males?
Males too. This sort of pelvic floor physical therapy can be helpful for men and for women. Certainly there's no age restriction. You can engage as early as you like in life or as late as you like in life. It's really up to you. In general, I find the really elderly patients have a little bit of a harder time with it because their muscles are so weak. But it doesn't mean they can't start their journey and benefit.
You've got my mind going. We're going to do a celebrity Olympics as a fundraiser for the City of Hope. I'm going to go challenge the City Council. I'm going to challenge the City Council right now.
It's going to be an exciting pelvic floor Olympics.
Yeah, what do you call this? Pelvic physical exercise. So
we'll have to get a special channel to host that. I don't know if that's
I think so.
Suitable for public digestion.
I can see it as a KHTS fundraiser. I already am envisioning this. Okay, and Yeah, my mind is going in weird ways right now. We're talking with the City of Hope. Dr. Seth Cohen is with us, and Amanda Egel-Cedar.
Nice.
So good.
Yeah, I got it down.
Perfect.
Who's she's in charge of the physician relations liaison, and you cover
Correct.
Santa Clarita and also
Santa Clarita, Simi Valley, and Mission Hill. So we have community practice sites in all those areas. So I work in the community to let the local physicians know what we offer, what kind of cases we take, what kind of clinical trials we have, those kind of things. So
we're going to take a break. We're going to talk about some more of the real future stuff. We'll get onto the Star Trek mode and head away from the leeches from 100 years ago and talk about some of the things to look forward to in the future. But as we're listening to this, I'm discovering many things that I could start doing. One is the exercise, the pelvic exercise, but we're going to learn about more of those from Dr. Cohen in a few minutes. Maybe we'll create a whole Olympics coming up with this. We'll see, but we'll check it all out. Take a break. This is your hometown station, KHTS.
We know you've made some New Year's resolutions, and so did the Church on the Way Santa Clarita. The Church on the Way Santa Clarita is celebrating 10 years as a church, and they resolve to make the next decade even greater by continuing to love God, serve people, and change lives. Join them on Sundays at 8:30, 10, and 11:30 a.m., where there's something available for everyone. They can't wait to meet you. For more information about what's upcoming at the Church on the Way Santa Clarita in 2018, visit tcotwsc.org.
We all know someone impacted by the Las Vegas tragedy. It's touched our valley and thousands of households. Many of us were actually there. In Santa Clarita, we had 1 fatality and 14 injured by bullets. Many more were injured trying to escape. Others are still traumatized by their ordeal, finding challenges returning to normal lives. The law firm of Owen Patterson Owen is helping many Las Vegas victims get financial assistance for their ordeal. If you know someone impacted by the shooting, visit opolaw.com.
Men, are you feeling tired, stressed, or just don't have the energy you used to? Did you know this could be related to decreased testosterone levels? Luckily, there's a safe, effective solution. Weeder Prime helps support healthy testosterone levels with clinically tested key ingredients. Just 2 capsules of Weeder Prime each day can help change your mood, energy, focus, body fat, and lean muscle. Feel the way you felt 10, 20, even 30 years ago. Rediscover your Prime with Weeder Prime. To find a retailer near you, visit WeederPrime.com. That's WEIDER Prime.com.
Hometown. Your hometown station.
I can change the world. 98.1 FM and KHTS AM 1220, your hometown station. Carl Goldman here. Special 1 hour with the City of Hope's representatives. We have Amanda Egel-Cedar. Egel-Cedar is with us, and she is the physician relations liaison for Santa Clarita. And then with us is Dr. Seth Cohen, learning a lot about urology, more than we ever thought we could possibly learn. But if you're just tuning in, just catching the show, you're going to want to stick around because a couple interesting things. One is City of Hope has a large presence now in Santa Clarita. They have a full facility right diagonal from City Hall on Valencia Boulevard. They also are tied into all of our great hospitals here in the area, including Henry Mayo and also Providence Holy Cross. And we're just thrilled to have City of Hope part of Santa Clarita. Their main facilities down in Duarte have been around for many, many years, one of the leading institutions for cancer research, children's cancer research, so many different areas, and we're learning about some of those. But right now we're talking about some specifics all of us can do to prevent challenges, prevent actually seeing you, doctor, in the future.
Yep,
We're learning about exercise ahead of time, saying don't get pregnant, don't get old. But aside from that, there are lots of things that we can do to prevent some of the things that may need us to come see you in the future. But I thought we'd take a minute before we get into some of the other exercises and also where your field is heading in the future. Maybe you can share a little bit about your background and how did you arrive at this specialty?
Sure, yeah. So I grew up in North Orange County and went to school in the Midwest, undergrad med school at Northwestern. And then decided in med school that I was interested more in a surgical subspecialty, but really liked medicine as well. And so urology is one of those really wonderful disciplines where you get to have both a medicine and a surgical mind. And what that means is you develop really interesting long-term relationships with patients. You treat them in your office for various disorders, but you're also operating on them, and you're making their lives better with direct surgical intervention. And subsequent to my medical school training in Chicago, went back to California to my origins and did post-medical school training at UCSF and UC San Diego. I was a urology resident at UC San Diego, and then ultimately went up to UCLA to do a fellowship. So my training at UC San Diego was in urology, which is really the discipline that deals with the kidneys, the bladder, male reproductive health, to some extent a little bit of female reproductive health. But what I became interested in was reconstruction. And so I became interested in the idea that we could take the urethra and the bladder and improve someone's quality of life by surgically reconstructing tissues around those organs. And these are disorders commonly experienced by women, but also experienced by people suffering neurological disorders, so Parkinson's disease, spinal cord injury disease. All of those processes actually impact the bladder, believe it or not. And it was through meeting those patient populations and learning a little bit more about that subspecialty discipline that I decided to pursue the additional training at UCLA. And so my field is called female pelvic medicine and reconstructive surgery. And really, it's a wonderful combination of both gynecologists and urologists that really work together to improve quality of life. And both urologists and gynecologists do specialty training to have the knowledge set they need to answer questions and treat this patient population. So it's not dissimilar. Sometimes you'll meet orthopedic surgeons and neurosurgeons that both do spine surgery, or you'll meet plastic surgeons and orthopedic surgeons that both do hand surgery. Well, this specialty is one of those specialties where you have a group of urologists and a group of gynecologists that both do pelvic floor reconstruction. And so when you're seeking out care, usually women are getting access through their gynecologists to subspecialty providers. Those gynecologists probably have a really good knowledge set, but if they don't, they'll likely refer you to a specialist in female pelvic medicine and reconstructive surgery. And that could be a urologist or a gynecologist.
We're talking about how quickly medicine is shifting right now, what's on the forefront with research. How do you stay on top of things?
That's a great question, actually, Carl. And so I think we're very fortunate in this era to live with things like Twitter, Facebook, and the internet, and all of those things together. Honestly, I get so much of my digestible continuing medical education from Twitter these days. There is a fabulous online Twitter community for urology that shares research, emerging ideas, has reasonable discourse, all on Twitter. And so probably, some people use their Twitter accounts for personal. My Twitter account is really all professional because I use it so much to learn about meetings that are, you can do virtual meeting attendance with Twitter to understand what's going on at meetings. I'll use it as well to help publicize some ideas we want patients to know about. And so for my Twitter, it's at Dr. S. Cohen, DrSCOHEN, at DrSCOHEN, and I'll put a whole bunch of interesting things on there that I think can benefit patients, but I'll also interact with my colleagues. And so I get a lot of my information through Twitter. I get a lot of it through the internet as well. So YouTube has some really fabulous channels that the organizations I'm a part of, the American Urologic Association, the American Urogynecologic Association, the International Urogynecologic Association, all these organizations now have YouTube channels that they put videos on that are really wonderful didactic tools.
But you are versed enough to be able to know the real stuff versus the nonsense that's out there.
Yes.
I'm not that smart.
Right.
And that is not my field.
Right.
Radio, I can snuff that out pretty quickly. So what would you recommend for me? Amanda, I don't think you're totally versed either, right?
Yeah, this would be
right.
useful
So
for me as
so
well.
No
for
problem.
both of us,
Yeah.
what would you recommend for us to go to, and what also would you recommend for us to avoid on the internet?
Okay, let's start with the latter first. I would avoid chat rooms. So chat rooms are nothing against support groups and chat rooms. The problem is it's not controlled content. And so you have people going on there that are giving their opinion, which, may have no foundation whatsoever. I mean, everybody deserves to have a voice, but a lot of chat rooms you go on, it's just shocking about the things you read and the things you see, okay? And honestly, every now and then there's some really helpful stuff on there, but there's also some very unhelpful, untrue stuff on there. And so I think any sort of chat room environment that's not controlled by someone auditing the content from a professional organization, I would be wary of. I would also, Yelp is something we use commonly. Yelp can be a good tool to learn about providers, but be a little wary of that as well. Because remember, it's someone's one-time experience or interaction, and it may not be an informed interaction, and so be wary of that too. I think good information comes from established organizations that have a proven track record of legitimate physician, involvement. And for this particular topic we're discussing today, I would say there's two organizations I direct you towards. There's one website called voicesforpfd.org. So that's VOICES for FOR PFD, P as in Peter, F as in family, D as in dog.org. That stands for Voices for Pelvic Floor Disorders, okay? And that's a really fabulous website that's put on by the American Urogynecologic Society. And it has just a plethora of information on there for patients about where they can find providers, and also information about the disease processes themselves, including handouts they can download. And so I think that's a wonderful access point for patients if they're going to use the internet. I think another good website, or at least organization to know about, it's called Urology Cares, so Urology Care. So I think if you Google anything, Google Urology Care, okay? And that is an organization that is actually associated with the American Urological Association. And that website also has some really fabulous stuff. So if you Google Urology Care, you're going to get some really good links to that organization, and there's some really educational stuff on there.
And while you're surfing the internet, make sure you stop by cityofhope.org and check that out. And Amanda, there's a really cool section now really covering Santa Clarita and our valley.
So you can go to cityofhope.org/Santa Clarita. You can always call us as well. So it would be 661-799-1999. We've started this trend with when Kyle's hosting that I give tours. So you can come into the office and find me. I'll give you a tour. That's a thing now. So I guess put that on my business card next. But,
right, the tour guide.
If you want to learn more online about Santa Clarita City of Hope, it would be www.cityofhope.org/Santa Clarita.
Good. That's good information. And why don't you share just briefly the array of services you have here in Santa Clarita?
Yeah, we have a 8,500 square foot building that offers, we have an infusion room, we have exam rooms, procedure rooms. Of the specialties we offer, again, we have medical oncology and hematology, general urology and urologic oncology. We have urogynecology, gynecologic oncology, and surgical oncology. There's a lot. I hope I've hit all of them. But yeah, we have comprehensive cancer care available for anything.
Which is tremendous. And once again, cityofhope.org, phone number, local number here, 661-799-1999. Dr. Cohen, one of the areas when we were taking the break, we were making a list of some of the things to talk about, and surgeries would be one of them. First of all, where are most of the surgeries taking place that you do?
So most of the surgeries I do are actually at Huntington Hospital in Pasadena, but certainly we have the ability to operate at Henry Mayo Newhall as well, and Providence Holy Cross. But between those three institutions are typically where I do most of my operations.
And anything special on the forefront that's happening with surgeries right now? What's changing in that area?
Yeah, there's some exciting things to help make surgery less needed. It's funny because surgery is one of those disciplines where if you talk to surgeons who are a lot of them who are forward thinking, they feel like it's their job to make surgery less necessary in the future. And I'm of that mindset. I think that's a great goal. I think some exciting things on the horizon is that there are ongoing trials. So there's something called stress incontinence, which essentially is leakage of urine from the urethra because of a weakening of the muscle around the urethra. And it's a very common disorder. And, it's really, once again, one of those quality of life issues where, listen, a lot of women have it. It doesn't bother them. But I see a number of women that it really debilitates their life. And, they can't be out without being wet and feeling like they're malodorous or smelling themselves. And so there are some things on the horizon, such as injecting mesenchymal stem cells into the tissue around the urethra. And so you'd actually take cells that would mature into muscle and inject them into the urethral tissues and let them grow into those tissues. Now, the data is a little bit 50-50 on whether or not this is something that's truly helpful, but it shows you what's being thought of and what's being done. And these are, there's ongoing work that's going into that. There's a whole discipline that's dedicated to nanotechnology and essentially growing, this is to break it down for you, growing bladders and urethras on scaffolds, nanofiber scaffolds that could potentially one day replace those organs for people that have lost them, perhaps in cancer surgeries. So maybe they had to have their bladder or the urethra removed because they had some sort of awful pelvic floor malignancy. Down the road, we may just give them a brand new urethra or a brand new bladder after growing these organs on a scaffold outside their body ex vivo. And this is exciting stuff that's been in development for years, but we're starting to get to that point
and
where...
and just to interrupt you
Sure.
for saying, is that grown from DNA taken from them so that it is in there, or is it done totally artificially removed from that individual?
All of the above. And so there have been instances where they've taken tissue from pigs or from cows and tried to derive that into functional organs for people. There have also been instances where they thought of just taking mesenchymal stem cells from the person, him or herself, and then growing that out and then reimplanting it back into the person. I mean, this is stuff I would hope by the end of my career, if I stop eating the Carl's Jr. and the In-N-Out, that I'll be around to see this in about, who knows, 50 years. I think we're looking at a 50-year timeline to have that done. That's be my best guess. I hope they beat it. But you could really see where in 50 years this would be fairly, we do these kidney transplants now. We'll be growing kidneys. I mean, people won't need to be transplanting from cadavers or from other family members. We're just going to grow them a kidney and it's going to be implanted.
And then while we're waiting those 50 years, it gets back to prevention as being one of the keys, and we've already touched a lot on that. But you want us to talk about UTI prevention?
Oh yeah, the reason I want to just briefly talk about urinary tract infections is because it's so common. I mean, I see so many women who are young women, middle-aged women, postmenopausal women who are experiencing recurrent urinary tract infections, and it's one of those things that can really be a quality of life issue as well if you're constantly on antibiotics. And so what I would say is this, when it comes to urinary tract infections, make sure that you're going to a doctor who's actually checking the urine. Okay, we've all been in instances, including me, where a patient calls you on the weekend and they're in a lot of pain and you just want them to feel better and you'll give them some antibiotics. But in general, antibiotics should really be treated as a precious, scarce resource. And every time you introduce antibiotics into your body, you're creating resistance. So you only want to take antibiotics when you truly have a urinary tract infection. And we're learning a lot about something called the microbiome. That's kind of a catchword these days. Everybody has a microbiome or a collection of bacteria that live in their body. And every time you take antibiotics, you're hurting or changing that microbiome. So we can't look at antibiotics anymore as like a vitamin. I mean, oh my God, I need my antibiotics. It really should be, I think I need to be on antibiotics, but I need to make sure. And so you want to go to a doctor who's really checking your urine specimens, who's really doing the diligence to make sure you have an infection, and then treating you with the appropriate antibiotic therapy. In addition, if you're someone who's getting a lot of urinary tract infections, and I would say more than 3 a year is a lot, then you probably need to talk to a provider about how to prevent them. And there's a regimen I put people on to help prevent urinary tract infections. For instance, one of the things we do if you're a postmenopausal woman or perimenopausal woman is actually have you apply a vaginal estrogen cream to the vaginal tissues 2 or 3 times a week. And I want to iterate, that's not systemic hormone replacement. I don't do systemic hormone replacement. This is really just a local estrogen therapy, those tissues, because as your body has changed, as you have changed, as you've matured, it's dry and irritated down there, and it becomes to some extent a breeding ground for bacteria. And so that's a prescription that we provide people. Another thing to think about is taking a daily probiotic, and so really trying to bring good bacteria into your body every day, and that could be daily yogurt. Maybe that's a probiotic you pick up at your CVS or your Walgreens, but that's something that could be beneficial as well. Another thing to think about, and this is a challenge for the elderly patients in particular, is this is the fancy word, perineal care. But really what it means cleaning the area down on the pelvic floor. And I'm not just talking about wiping poop away with a tissue paper. That means really cleaning that bicycle seat area, that area between the rectum and the vagina, or perhaps the rectum and the scrotum, where bacteria live and they travel through. And we don't have bidets in America, right? Bidets are kind of a European, thing, perhaps Japan, but they're actually quite helpful because they cleanse that area. If you don't have a bidet, and you can buy one at Lowe's and attach it to your toilet if you like, perhaps baby wipes or maybe a spray bottle of soap and water to really cleanse that area between the rectum and the vagina, so you reduce the bacterial burden that is living there on a chronic basis.
With baby wipes, any particular kind that you should be using or looking toward?
No, in general, I prefer, I recommend unscented baby wipes. I mean, they're typically hypoallergenic products, baby wipes, but probably the less, irritative, the better.
Also, as I understand it, if you're trying not to kill the good bacteria, having a heavy alcohol-based wipe is probably not a good thing because it could also be killing the good bacteria as well as the harmful bacteria.
Yeah,
right?
no, that's exactly right. So look at the product you're purchasing, make sure it's something that's going to be beneficial for you and help in your hygiene.
KHTS, AM 1220 and 98.1 FM. Carl Goldman with you, along with Amanda Egel-Cedar with the City of Hope, and Dr. Cohen is with us as well, Seth Cohen. We're going to take an early break for a second because I want to dive into what's in store for the future, and I want to do that after we get back. Hometown Station.
Sweet, salty, tastiest, bacon and pancakiest. Big yawns are okay, yummy syrups, yes way. Butter pecan, blueberry, old-fashioned strawberry. Never empty coffee pot, Mom says it hits the spot. Almonds are the fluffiest, Dad tucks the scruffiest. Scrambled eggy, pepper shaky, orange juicy, wide awake, stuffed French toastiest. Waffles with the mustiest, buttermilky, smooth, silky, tastes great. Love on a plate.
IHOP, everything you love about breakfast.
The Santa Clarita Artists Association has a new gallery in downtown Newhall on 6th Street between Main and Railroad, right across from the Canyon Theater Guild. The gallery features our members' paintings, sculptures, and one-of-a-kind handcrafted gift items. Whether you're an art lover, buyer, or an artist wishing to join, visit our website at santaclaritaartist.org, come to our free monthly meetings at Barnes & Noble, or stop by the gallery. For upcoming events and exhibits, check us out at santaclaritaartist.org. We make visual art visible.
The Harlem Globetrotters will bring their amazing feats of basketball world tour to the greater Los Angeles area from February 17th through February 25th. Witness amazing Globetrotter moments that become unforgettable Globetrotter memories. Prepare to be amazed by the ball-handling wizardry and experience the antics that will have kids of all ages laughing the entire time. Don't miss the world-famous Harlem Globetrotters, February 17th through February 25th. Game schedule and tickets at harlemglobetrotters.com.
Hometown. Your hometown station.
1248 this beautiful Wednesday on KHTS, AM 1220 and FM 98.1. Carl Goldman with you. It is a special hour with folks from the City of Hope. We're with Amanda Egel-Cedar and, of course, Dr. Seth Cohen, who's been sharing so much. I've learned a lot, and we're not even done yet. But I wanted to share, first of all, City of Hope. They're here in Santa Clarita, as well as, of course, their main campus down in Duarte. City of Hope here in Santa Clarita on Valencia Boulevard, right diagonal from the City Hall, our Santa Clarita City Hall, with a full array of services over there. And Amanda would be happy to give you a tour. Simply call her at 661-799-1999. cityofhope.org/Santa Clarita will get you there as well. Dr. Cohen, we've been talking about a number of things, and we touched upon this just briefly, and that's being our own advocate and really understanding our bodies, listening to our bodies, not being scared if we have some signs that might rely on us calling on you. Right. Maybe you can elaborate on that a little bit.
Sure. I think when, in today's world of medicine, especially in the US of A, you have access to some really quality care, but all doctors are busy running around, and the visits tend to be shorter than we would like. And so there's not a lot of time to get everything said and done. So number one, I always tell patients, before you go see your doctor, have a list of things that you must hit before you walk out of that door, because it's very easy to get lost in the conversation and not hit those points. Number two, if you have something that's really bothering you, and when it comes to pelvic floor disorders, incontinence, going to the bathroom all the time, recurrent urinary tract infections, don't forget about that, because to some extent your quality of life and how you live it is extremely important to you as a person. And this is your opportunity to have that interaction with your provider and see if there's something medically that could be of help for you. And so, sometimes very often those doctors will forget to ask about those things because really, truthfully, they're trying to manage blood pressure and cholesterol and some very significant lifelong processes. But these are quality of life things of the pelvic floor that I want you to take a moment and be an advocate for yourself as well. Like I tell patients, I see myself as wanting to help you live the life you want to live. We want to give you a quality of life that you deserve. I have patients walk into my office now. We're seeing nonagenarians, people that are 91, 92, 93, that really want to have a reasonable quality of life. And the expectation is not that, hey, listen, they're 91, forget it. The expectation is, hey, listen, I'm here in your office. I want to be able to walk outside and go play with my great grandkids. What can you do? And so you have to be an advocate for yourself when it comes to your quality of life, especially in the world of pelvic floor disorders. If these are problems that are bothering you, please bring them up with a provider. Perhaps they can refer you to see someone. Perhaps they can help you themselves. But don't just think there's no help out there. You deserve more.
As we fast forward into the future, you were already sharing things that are 50 years down the line. What about what's happening right now with robotic surgery?
Sure.
And where do you see that going?
Yeah, robotic surgery is an amazing tool, and Santa Clarita is fortunate to have a few hospitals in the area that have that tool. And really, it gives us the opportunity to treat patients surgically with less blood loss, less pain, and quicker recoveries. And so hospital stays that would have been 2 to 3 days in the past are perhaps same day, if not the next day discharge. And that's actually amazing when you think about it. I mean, there's a huge difference in cost and burden for both the patient and the system if you go home in less than 24 hours versus 72 hours. And it's amazing the quality of the surgical outcome as well, because it gives us the ability to have superb visualization intraoperatively, really amazing dexterity with the robotic instrumentation and arms. In smaller incisions, the outcomes can be fabulous for patients. They really can be. And so we're very fortunate in today's day and age to have that tool to help us increase our ability to help patients safely with less pain.
So between now and the 50 years we talked about before, what's in the short term for the future of robotic surgery? What are the next 1, 2, 3 breakthroughs that you see?
I think traditionally we've been using multiple incisions, so multiple sites, little 2 to 3 centimeter incisions. Perhaps you could see a point in the future where it'd be just one small incision, and there's different gel ports and other entry devices they're looking at where you could put all your instrumentation through one port in the body, and you have one small incision as opposed to 5 incisions. I think that's something that could be exciting. You're also looking at situations where the robotic instrumentation is going beyond just surgeries of the abdomen and the pelvis and is now being used for surgeries in the chest. So you have robotic surgeries that are now being used for cardiac surgeries, for thoracic surgeries, and we have surgeons at City of Hope that are doing this, that are using this technology. And so the robot is going from its origins of abdominal pelvic surgery really to pan body surgery and even neck surgery. And so really organ systems all over the body are seeing the benefit of this minimally invasive technology, and that's probably just going to continue to mature as this technology goes through time.
So you see it moving up to eventually brain surgery?
You never say never. Never say never. It's always possible. I mean, like I say, I'm constantly amazed by what I see and what I learn from my colleagues, and especially at City of Hope, there's just amazing advances every day.
We talked earlier about some of the exercises in preventive care, and the exercise are kidding about Olympics and everything, but are there other things that we can do long before if I was a female and
Sure.
getting ready to get pregnant,
Yeah.
what are some things that I should be doing in advance of even getting pregnant?
I would just highlight a couple of things that we've already kind of hit on to some extent, and that's, pelvic floor physical therapy, always a good thing. Not going to hurt yourself. Listen to your body. Don't ignore your body. I mean, listen, I hate to tell you, every ache and pain we don't have an answer for, and every sensation we don't have an answer for, but in general, if it's bothering you, at least talk to a provider about it so we can interpret that for you and say, listen, you know what, Ms. or Mr. So-and-so, you don't have to worry about that. It's okay. But don't ignore something. I find people get into trouble when they ignore symptoms and pain. And that's when someone comes in with a devastating process that shouldn't have been a devastating process. In general, drinking fluids is great. Hydrating well is great. I see a lot of people that drown themselves in water because they think it's the fountain of youth or someone told them they had to drown them. You don't have to drown yourself in water and drink fluids like chronically. I think in general, unless you're really an elderly person that can't self-regulate your fluids, you drink to your thirst. Now, if you're someone that gets a lot of kidney stones, we want you to drink a lot of fluids to avoid kidney stones. If you're someone that gets a lot of urinary tract infections, maybe fluid consumption can help you. But I find people walking around with water bottles all day for really I don't know where I think that's an old wives' tale or something, but you don't have to drown yourselves in fluids. But and the other thing is be an advocate. be an advocate. Make sure that you're coming to your physician with your questions and you're informed. Use a couple of really good websites to help educate you about what's going on. Try to stay away from chat rooms that are not regulated, because there's really good information out there online, but you just have to go to informed, reliable resources.
Yeah, don't get your medical information from me, for sure. Kyle Jellings is usually sitting in this seat, and he's now celebrating the birth of twins. They're number 4 and 5 into their young family. They're still in their 30s. And Paula right now is doing awesome after now her 4th and 5th pregnancy. What would you recommend for her and others that have just given birth? Are there exercises and things they should be doing?
Yeah. I think first and foremost is enjoy your children. Enjoy your post-pregnancy time. That's the main thing. But as you're starting getting back into the swing of things, your body's going to feel different. You may find yourself leaking some urine. In general, it gets better. But yeah, I would do Kegel exercises. I think that's to your benefit. I would perhaps seek out listen, there are even physical therapists dedicated to post-pregnancy mommy type physical therapy. And so you don't have to be a postmenopausal 75-year-old woman going to physical therapy. Actually, you'd probably be more beneficial for you if you're in your 20s and 30s and postpartum. That could really help you if you're interested in it.
And anything specific with diet for the post-pregnancy?
Dietary, no dietary recommendations. Enjoy yourself.
Just enjoy.
That's my recommendation. Enjoy yourself.
What's next for you? Where do you see yourself heading in the next 5, 6, 7, 8 years, Dr. Cohen?
Right, yeah. I'd love to continue to help develop the field of female pelvic medicine and reconstructive surgery. There's a couple of leadership organizations I'm a part of, and we have some great guidelines to help guide practices of physicians that I'm a part of and authoring those statements. And I really just want to help as many people as I can and help our specialty grow and develop to help people as well.
Well, thank you. This has been a fascinating hour. I've learned so much, and Amanda and I are going to be testing out all these things
absolutely.
the next
We'll work
few
on that
weeks.
Olympics together.
Well, thank you very much for having us.
City of Hope Show. We've been listening to Dr. Seth Cohen. He's here locally in our valley, Santa Clarita, at the City of Hope, right here on Valencia Boulevard. The phone number is 661-799-1999, cityofhope.org/Santa Clarita. Amanda Eggleseder, thank you so much for joining us. We'll see you next month. And you can check it out, hometownstation.com. This show, if you just tuned in late, is available as a podcast and also on YouTube at hometownstation.com.